Dr. Paul here. We get to see a newborn. Those are the best. Hello. How you guys doing?
Good. How are you?
Hey, congratulations.
Thank you.
All right, we got a cute little one here. All right, so I see the birth weight was 6'11", and we're at 6'9" already.
Awesome.
You are doing this is day 4. That's incredible. So, and that's strictly breastfeeding.
Yes.
Okay, well, you're nailing it.
Awesome. Thank you.
So, for my viewers, so I don't put them through the whole thing again, I've been in here, we've chatted. You're experiencing some engorgement, which is painful. That's common.
What does that mean exactly?
So the breasts start making milk before the ducts are all working. And my wife went through this, and just, you know, you blow up, you've got hard rock areas, and they're not flowing. And my wife put it, it was worse than labor. I don't know if you're experiencing that level of pain, but it's pretty bad.
Not yet,
Not
but
yet?
yeah, it's
okay.
getting there.
So, massage, you can do heat, massage towards the nipple, away from the nipple, and you can try pumping after nursing. This is actually an area of controversy in breastfeeding education. Most lactation people now say, today's video is sponsored by Let's Get Checked. Wouldn't it be nice from the comfort of your home if you could just get a kit mailed to you and get some of the labs you've been wanting to get done? You do them yourself. Pop them in the mail, you get your results within a week. You will actually get them reviewed by a physician, and a nurse will call you and go over these results. And if appropriate, they will often give you actual recommendations based on your results. And right from the comfort of your home. I am now able to bring this to you. There's a promo code DrPaul20, DrPaul 20. You get a 20% discount for your purchase by using that code. So for women and men, get your essential vitamin panel. Includes vitamin D, folate, and B12. These are probably my 3 most important nutrients that I want you to be aware of your status and take supplements if you need to. These are the key nutrients for healthy brain function. These are the key nutrients you need to have optimal focus, to prevent depression and anxiety. So many things that so many of us struggle with. So I've got direct links to the test I'm recommending you consider, but feel free to browse all the options they have because you may have a specific interest. I'm using this very test myself, just ordering my kit now with you, and we'll go over our results when I get them back. This is actually an area of controversy in breastfeeding education. Most lactation people now say, don't pump the first week or so. I don't know, have you seen Lactation yet?
Yeah.
Did they tell you that?
Yeah. I think they steered us away from pumping right away.
So I have mixed feelings about that recommendation. Sorry, my lactation experts. And here's why. I have seen too often where moms are clearly making a lot of milk, which is your experience, and you're not having this problem, but it doesn't flow, and then it turns off because it never got to flow. And then they never produce enough later on when the baby's needs go up. So baby's needs for volume change. You go from, 1 ounce day 1 and 2 to about 1.5 ounces now to 2 ounces tomorrow to 3 ounces next week to 4 ounces, 5 ounces by the first month to 6 to 8 ounces by 2 to 4 months. Well, if your production maxed out because it turned off, right? If those ducts don't flow, that breast tissue can't keep making milk. I mean, it's got nowhere to go. So it just turns off. And if you turn it off in the beginning, it never flows, it may not come back online. So we were chatting how, go ahead and get the pressure off, get some relief, get it flowing, you can freeze it. As soon as the latch is working well, and you're having some success with a nipple shield, which is great. You might be able to get rid of that later. Super. If not, don't worry about it. It's working. Right? But as soon as the latch is working well, then you get to kick in. So dads can help. And so dads can help and give mom a break. You're tired, right? Yeah. So it's exhausting feeding. You're feeding every 2 hours for 15, 20 minutes, you told me. I mean, think about that. All night, all day, next day, all night, all day, next day. This is forever. Not forever. It feels like it, right? So you get to jump in as soon as we've got a good enough latch to where we're not going to get nipple confusion, which I think is just kids figuring out, hey, that bottle was easier. Right? So if it's hard to get latched and you give them a bottle that's, and
Right.
sometimes the bottles release easier. I mean, it's just kind of easier. Then next time you try to latch, they're going like, where's that easy thing?
Yeah.
They're not confused. Give me the
They
easy
know what
thing.
they're doing, yeah.
So, but as soon as this is easy, then you jump in.
Okay.
You've got all that pumped milk, right?
Yeah.
So I think if you can give mama a stretch of sleep, your life will look a lot better.
Yeah.
It'll feel
Yeah.
better.
Yeah.
So I used to do it for my wife. Put her to bed at 8 or 9. Well, put her to bed. Yeah. Honey, you're going to bed. She'd go to bed early. I'd take the baby to the living room and watch a show or whatever, and then top my baby off with a bottle. Yeah, that baby behind the camera, that guy. And
I've got to.
you got to do it, that guy. And then I get the baby asleep, slide baby next to mama. I get to go to sleep. You know, if you sleep from 8 or 9 or till 2 or 3, whoa, wouldn't that be nice, right?
Wow, yeah.
So, or if dad, like we were talking, if you do shift work, maybe that doesn't work. Just pick a time where she can be asleep, you've got the baby. And you're gonna cover a feeding. You feed, go rest, go sleep, you cover a feeding. That really helps.
Okay.
All right, enough on that. You guys are killing it. You could probably feed twins or triplets.
Awesome.
You could donate actually down the road.
Yeah.
If you overproduce and what am I going to do with all this milk?
Yeah.
You know,
Oh,
buy a
absolutely.
freezer, donate. It'd be awesome.
Yeah.
Awesome.
Nice problem to have.
Right.
Sorry that you're suffering now, but it'll get better.